Infective endocarditis. Definition: infective endocarditis is infection of the membranes that line the insides of the air chambers or the air belts.
Cal should play with a review of endocarditis, cardiac valve vegetations, and stroke. Endocarditis can occur when there is fungal or, more commonly, bacterial infection in the bloodstream, a condition known as septicemia or sepsis. As the organisms travel through the heart, they attach themselves to the valve leaflets between the heart chambers. The oxygen and nutrient-rich environment found in the left side of the heart results in rapid growth of organisms, which form clumps known as vegetations. Unpredictably, the vegetations may detach from the valve leaflets. The vegetations are then ejected into the aorta, where they may travel up into the arteries of the brain, causing obstruction to blood flow and subsequent stroke.
One of the clinical signs of infective endocarditis have rogue spots are retinal hemorrhage, with pale or white-centered compound and surrounded by clotting fibrin on cluster of red blood cells. These spots can be seen in the fundus by using ophthalmoscopy.
Welcome to USMLE Memorizations. Today we're going to talk about endocarditis. What are some of the causes of acute infective endocarditis? Some of the causes of acute infective endocarditis are Staph aureus and Streptococcus. What are some of the causes of subacute infective endocarditis? Some of the causes of subacute infective endocarditis includes strep viridans and gram-negative bacilli. In acute infective endocarditis, do the normal valves or the abnormal valves get affected? In acute infective endocarditis, it's the normal valve that gets affected. In subacute infective endocarditis, are the valves normal or abnormal that are affected by this? The valves that are affected in subacute infective endocarditis are previously abnormal valves. What are some of the characteristic lesions seen in acute infective endocarditis? Some of the characteristic lesions seen in acute infective endocarditis includes Janeway lesions. What is Janeway lesion? Janeway lesions are non-tender macular patches on palms and sole. What are some of the characteristic lesions seen in subacute infective endocarditis?
Coat. The coat of rogue spots are found in patients with disease such as leukemia, diabetes, pernicious anemia, ischemia, especially in bacterial endocarditis, and rarely in patients with HAV retinopathy. Tracking. It's recommended that patients with a history of endocarditis, congenital defect, or abdominality in the hair belts are subject to periodic review and take antibiotics before and dental or surgical procedures. Treatment requires hospitalization is ordered to ensure proper administration of high-dose venous intravenous antibiotic at least for 2 weeks. Use applied in Ecuador. 20 cases of bacterial endocarditis rising hospital Ecuador ocular manifestation in endocarditis that they are seen is only 5% of rogue spots are took pathognomonic of bacterial endocarditis because they also occur in acute leukemias.
Hi, I'm Conrad Fisher. Welcome to our case endocarditis. It is a great pleasure on this day this outstanding educational endeavor. Now, our first case. Now, we have a patient, a 48-year-old man who comes to the emergency department with fever and murmur. I feel. Let's go. Blepharitis. Now, blepharitis is
Application is nursing. Perform physical examination to look for patient owner motor binding nodes in the part of the finger and toes. Rock spoke retinal hemorrhage. On escultation finds the damage to the endocardial pulse of fracture and valvular stenosis caused by vegetation located in the left may occur. The nurse verbalizes their colleagues about congenital disease and prevention of complications during the regular medical assessment. Reduce the risk of complications in the person with congenital heart disease by diagnostic monitoring and treatment. Conclusion: infective endocarditis is caused by skin pathogenic and steric strenococci, for example, in elderly patients with colon tumor rather than more classical oral streptococcus. Spoke rocks are not only vascular lesions caused by infective endocarditis but can also occur in patients with hypertension, leukemia, and diabetes.